I would like to introduce you to Eric Crawford. He has a few words to say, and he would like to address the committee.
My name is Eric Crawford, and I'm from Mason County. And just like Jaime, I wake up thinking about my health and worrying about my health all day and going to bed thinking about my health. Good morning. My name is Eric Crawford, and this is my wife, Michelle. I am here today on behalf of myself and Kentuckians for Medicinal Marijuana, a nonprofit organization. Thanks for allowing me this opportunity to speak with you about an issue that is personal for me. I'm going to talk to you about medical marijuana. First things first, I'm not here to talk about recreational pot. I don't care about Joe Blow getting high on weed. I'm here to speak about medical cannabis and the immediate need for the laws of Kentucky to change to allow truly sick and disabled people to legally use medical marijuana as an option for treating their illnesses. I'm a lifelong resident of Mason County. In 1994, I was a passenger in a motor vehicle accident. It was a dark night, and the car I was in hit a cow that was in the road. As a result of the accident, I'm a quadriplegic and confined to a wheelchair 24 hours a day, and I need round-the-clock care all the time. My life is a struggle of constant nerve pain, ungodly muscle spasms, extreme stiffness, arthritis, chronic urinary tract infections. I need to prepare something. These are the pills I take. These in there are my hydrocodone. They are the pain pills that I take. They make me feel crazy. My body and mind do not tolerate narcotics. I'm aware that I am very nerve-wracking when I have to resort to taking them. My favorite thing to do is sit and talk with my dad. Even my dad has a hard time dealing with me when I take pills. If I could legally use medical cannabis, I would not need any narcotics. I could use less of these other pills too. As if being crippled isn't enough of an issue, I have many other medical conditions. I've been followed by Dr. Henry Kaplan and Dr. Johann Sotal at the University of Louisville, Kentucky Lions Eye Center for 11 years. I travel 170 miles 6 times a year to see these well-respected doctors. I have an autoimmune disease called optical uveitis. In layman terms, this is an inflammatory of my optic nerve to my brain. This disease causes my vision to be very distorted. I am on very powerful immunosuppressants to try and slow the progression of this ailment. This disease may very well lead to blindness. As a result of my eye disease, I have uncontrollable glaucoma. Even on the strongest doses of all prescription medications for glaucoma, my eye pressure isn't controlled. My doctors recommended I use marijuana as a way to lower the pressure in my eyes. It is a fact that medical marijuana, along with my prescription medications, controls my glaucoma. My eye doctors told me if my glaucoma was controlled, I'd be blind in a year. Medical cannabis calms my muscle spasms, relaxes my stiffness, eases my nerve pain, reduces my inflammation in my whole body, and lowers the pressure in my eyes. I do not want to be blind. Medical marijuana calms my mind but doesn't make me out of my mind. Life in this wheelchair is not easy. I am a sick person who needs medical cannabis for relief and a better quality of life. I am not the only person in Kentucky who needs medical marijuana. Medical cannabis is proven to treat many health issues. People we all know in our communities with cancer, glaucoma, post-traumatic stress disorder, Alzheimer's, autism, and many other illnesses should have the choice to participate in a safe and humane treatment option. A May 2013 Fox News poll found that 85% of Americans believe that marijuana should be allowed for medical purposes if the doctor prescribes it. 1/3 of Americans live in a state where patients can legally use cannabis with their doctor's advice. There needs to be a common sense, compassionate reform of the law in Kentucky to help the truly sick and diseased and disabled citizens of the Bluegrass State. We have a moral duty to stand up for these rights of our afflicted family and neighbors. I have a right to stand up for myself. Senate Bill 43, the Cannabis Compassion Act, and House Bill 350, the companion bill, have been introduced to the Kentucky legislature in 2014. If they would have passed, it would have allowed medical marijuana for the sick in Kentucky. I am asking you as leaders of our state to help me get these laws passed. I am a desperate person. I'm asking that each one of you here stand up for me and my rights. I'm asking you to put yourself in my shoes, or the shoes of someone genuinely ill and disabled people of Kentucky. At the age of 42, what would you have me do? Would you leave the only community you've ever lived in, your elderly parents, your home built just for your needs, the land you love, your friends that help you, for pain relief and for your eyesight? Would you stay in Kentucky and be viewed as a criminal? Would you break the law and risk losing your home and freedom? Would you do nothing and suffer and go blind and be in pain for intolerable? Cry to your wife and parents? I should not have to choose any of these. The laws have got to change. Please help me. Thank you for your time and attention, but most importantly, your support. I am counting on it. Please vote in favor of the Senate bill and the House bill that will be brought to you in 2015 session. Stand up and fight for me. This is the ethical, compassionate, and the only right choice. And in your hands lies 2 doctor's notices recommending me to use marijuana. In any 22 states in the District of Columbia, I could get marijuana with this doctor's recommendation. But I would not leave this state for nothing. I love this state. We have good people. I don't want to leave. I'm not going to leave. I'm going to fight for my rights like I should. And you also have a resolution from Mason County Fiscal Court saying they are ready for the sick people of this state to be able to have a choice to use marijuana for their illnesses. And for sick people not to go to jail, not to fear the law for using marijuana, which we shouldn't. We're just trying to be healthy. Thank you.
Thank you, Eric.